Welcome to DBMCI and eGurukul. In this session, I'll be going over the questions that were there in the July 2021 INI-CET exam. There was one question which was asking you about the deficiency of which of the following vitamin leads to the deficiency of the tetrahydrofolate. This is among one of high yield topics that we have discussed in the class also. So as you can see from here, this adenosyl homocysteine gets converted into methionine. This is done by enzyme methionine synthase. This is the process how we synthesize the methionine in the body, and that utilizes the methylcobalamin, that is vitamin B12. Okay, so and from adenosyl homocysteine to methionine, there is an involvement of one methyl group, and that methyl group is donated by 5-methyl tetrahydrofolate, which itself gets converted into tetrahydrofolate. So if there is a deficiency of methylcobalamin, then it leads to the deficiency of the tetrahydrofolate. Opposite to this, there is an enzyme cystathione synthase, which converts homocysteine, which reroutes the homocysteine into cystathione. There are many cases when this enzyme is deficient, or maybe this vitamin that is involved there, vitamin B6, is deficient. That leads to the increased level of homocysteine, which will route the homocysteine to make the methionine, right? And there will be more formation of the tetrahydrofolate. So examiner किसी भी तरीके से question पूछ सकता है. So you should know this, and this is one of the high yield topic. Right? Which of the following enzyme is down regulated in the presence of the insulin? Well, insulin is an anabolic hormone, right? And when we talk about the first option, that is hormone sensitive lipase, as the name itself is indicating, this enzyme is sensitive to the hormonal level, that is insulin, and the enzymes that work in opposite direction to the insulin. Right? Hormone sensitive lipase is an catabolic enzyme. It catalyzes the lipolysis in the adipose tissue. It converts the triacyl glycerol into the glycerol and the fatty acid, which leaves the adipose tissue via the circulation and reaches the liver. Right? There are counter-regulatory hormones of the insulin like glucagon, growth hormone, norepinephrine, cortisol. They work with the lipoprotein lipase because this is an anabolic hormone. This is an anabolic hormone. Answer to this is hormone sensitive lipase is down regulated, right? Because insulin is anabolic, it wants to synthesize, whereas HSL is a catabolic, it wants to break down. Lipoprotein lipase is upregulated in the presence of the insulin because it synthesizes the triacyl glycerol and help in its storage in the liver. RNA is used in which of the following techniques? Well, the Sanger techniques is the method of determination of your DNA sequence, and also this is the first method which helps us to know कि DNA की sequence कैसे होती है, and this was also the first technique that helps us to determine the protein का sequence क्या रहता है. So that is the Sanger method. It is nothing to do with the RNA, right? So ये choice नहीं हो सकती है. Rtpcr, Western blot and Southern blot. Well, there are three main blotting techniques we talk about: the Southern blot, Northern blot, and the Western blot. The Northern blot has to do with the RNA, which is not a choice. So Western blot is for proteins, so this is not the choice. Southern blot is for DNA, which is not the choice. We are left with Rtpcr, that stands for reverse transcriptase PCR. Nowadays, it is very popular because of the COVID-19 that is going on. What it does is, it has the RNA as a starting point, which gets converted into DNA by the reverse transcriptase enzyme, and then we do the DNA amplification by the regular polymerase chain reaction, in which the DNA samples are amplified to the multiple times, right? And that has majorly 5 steps to it. First is the denaturation, when the DNA strands are separated from each other, and then there is an annealing of the primers. The primers, they come and anneal to the DNA. Following that, we add all the Taq polymerase that is going to do the elongation, which comes afterward, which is the third step. And all the deoxynucleotides like DNTPs or Another word we can say D-adenosine triphosphate, D-adenosine and guanosine triphosphate. So all these things are added with the buffer so that there are no secondary structure formation into it. So RT-PCR is the method which uses RNA. PCR, original PCR uses DNA as a template, whereas RT-PCR or quantitative PCR or real-time PCR, which is used for the COVID-19 testing, can take RNA that is coming from the SARS-CoV-2 virus as an input, and that RNA is converted into DNA. Well, the sensitivity and the results of RT-PCR definitely depends upon the purity of the sample, how pure the sample is, how much precaution it has been taken while taking the sample to be tested. Okay. Next question is RNAi causes the following in the gene, and that is again this has come previously in May 2015. There were many questions which appeared in AIIMS May 2015, 2016 also in this INI-CET exam. Well, what is RNAi? RNAi is a interfering RNAi. It helps in co-suppression, or you can say the post-transcriptional gene silencing, PGTs. Okay, and it is known as this method for silencing the gene is very precise, efficient, stable, and it is better than any antisense therapy that has been used in biotechnology in the modern era for the gene suppression. Right, what happens is whenever you have the viral infection, then the virus is throwing its genetic material, that is the RNA, double-stranded RNA in the system, right? So the dicer that is present in the system comes and binds and chops that viral RNA, right? That infected RNA coming from the virus and into smaller pieces. These are known as siRNA, silencing RNA, which were chopped into pieces by the RISC enzyme. RISC is a big complex which stands for RNA-induced silencing complex. What it does is it separates the strands of the siRNA, right? And then it has the complementary RNA comes and binds to it, and with the nuclease activity of the RISC complex, it gets chopped off into smaller pieces, thereby doing the gene silencing, right? It inhibits the gene expression or translation by neutralizing the target mRNA molecules. This is another statement which can be asked in the exam. This is another way of saying the same thing, right? In this chart, I'm trying to give you a different methods of the gene silencing. You can use the RNAi, that is RNA interference, antisense DNA, dominant, negative mutants, knockout animals, small molecule inhibitors. All these are available in the market. So, but RNAi method is the best method. It is very specific. It is very easy. Only the drawback is it can do the gene knockdown, not the knockout. And what is the gene knockdown? Gene knockdown is a temporary method of gene silencing. Whereas gene knockout मतलब knockout करके उसको out ही कर दिया, gene is out, so it is not going to work. Whatever the protein it was going to make or whatever function it was that gene was related to, वो permanently वो खत्म हो जाता है. So this is the difference between gene knockout and knockdown. Okay, so RNAi क्या करेगा? Answer to this is the gene knockdown, that is option C. Okay, now there were another options like gene knock-in or knock-up. क्या होता है? Knock-in में we insert the gene at a specific function. Let's say there is a gene mutation. This is used for the gene therapies also via the CRISPR-Cas system, which is very popular nowadays. So gene में there is a mutation, or we want to give a special function to the animal we are testing upon. ठीक है, तो उसमें gene insert कर देते हैं, which was originally not there. Or if there is a mutated gene, we insert a corrected gene in there so that that disease is gone away. So this is gene knock-in, and knock-up is the upregulation of a gene. Let's say किसी बंदे के अंदर is suffering from a disease because enzyme का level कम बन रहा है. Enzyme कम quantity में बन रहा है because of something that is there is some problem with the gene. So we can upregulate the gene so that gene expression is higher and the enzyme formation is higher. So these are all kind of things that the biotechnologies nowadays are, technologists nowadays are exploring to cure the various diseases inherited and various deadly disease as well as the rare diseases. Okay. Which of the following is used by RBCs in the fasting phase? RBCs don't have the nucleus. Always there is an anaerobic glycolysis going on. So it preferred to use glucose no matter what, right? That is the preferred method of like RBC is survives on the glucose. Okay, very easy question. Brain usually survives on the glucose, but on the starvation, ketone bodies bhi wo is happy to use. Adipose tissues gains the energy from the fatty acids and the glucose, right? Liver can survive, liver survives on the fatty oxidation for the energy. There was one question of this question was given to me by quadruple screening that does not include the following, though it is not a part of a biochemistry, but still, since it was given to me, I am trying to give you the answer to it. In the quadruple screening, what we have is there are four things that are involved, and these quadruple test is done during the 15 to 16 weeks of the pregnancy, right? Or we can say these are the second trimester markers, right? It has the four markers that are given here is alpha fetoprotein is there, unconjugated estriol, that is UE3 is there, human gonadotrophin is also tested for. Instead of inhibin A, it has inhibin, instead of inhibin B, it has inhibin A, right? So this is the answer. It is not included in the quadruple screening, rather inhibin A is involved. Next question was miRNA, microRNA binds at the which region of the mRNA? Well, now here we are talking about mRNA. mRNA is this mature RNA. Okay? Initially, when we are doing the transcription, okay, we have this heteronuclear RNA. There is a lot of things that is there in this. We chop it off, we make it very nice. Introns remove kar diye hain, right? We have a cap that is 5 guanylate cap. Then we have the mRNA region. Then we have the poly-A tail. And that mRNA region also is divided into 3 parts. So you have cap on this side. Let me pick the pen. You have the cap here. Following the cap, you have 5' UTR region. And then you have the coding region. Then you have 3' UTR region. And finally, you have the poly-A tail. Right, poly-A tail ऐसा होता है. So these UTR is the untranslated region. They don't code for anything, but they are there. So miRNA binds to the 3' UTR, which is option C to this answer. What it does is it works in various ways, and how it works is, first of all, these miRNAs are very small, highly conserved non-coding RNA molecules होते हैं. Name is suggesting RNA. So बहुत conserved RNA molecules होते हैं. And that is synthesized in our body by the RNA pol 2 and also RNA polymerase 3, both. Majorly by RNA polymerase 2, right? It regulates the gene expression and also does the RNA cycling. And there are these miRNA that are circulating. They serve as a biomarkers for the various diseases. This is one of the very important function that can be asked in the coming PG, because this topic is again a very high yield topic, right? It binds to the 3' region of their target mRNA with the purpose that it is going to disrupt this poly-A tail. Poly-A tail and the 5' cap. What they are doing is they are adding the stability कि mRNA degrade ना हो जाए. वो protect करते हैं. Like when newborn baby is born, newborn baby is born. That is a nascent baby, right? What we do is we put a cap, we put the small socks so that baby is protected. Same way mRNA is protected by adding a cap and adding a tail. miRNA binds to the 3' untranslated region and disrupts the poly-A tail. उसके साथ छेड़खानी करता है, तो mRNA becomes unstable and finally degraded. Degrade हो जाएगा. Maybe it will get chopped off into 2 pieces also, right? It represses the protein production by, let me erase this, right? Represses by cleavage of mRNA strand into 2 pieces. वो भी कर सकता है. Right, and then destabilization of mRNA by shortening the poly-A tail, right? And less efficient translation of mRNA into proteins by the ribosome. This is how it works upon by 3 mechanisms. So this is the microRNA that is formed inside the body. Initially, it is almost like a hairpin loop structure, right? And then this hairpin loop structure, this is disrupted by the dicer, and the strands are separated. It comes and bind to a 3' coding 3' UTR region of the mRNA, and it plays a foul game with the poly A tail, thereby disrupting or destabilizing the mRNA. This is how it works, right? Now, miRNA and siRNA, two things, right? They have something to do with the like mRNA. They destabilize the mRNA. So I have made this chart just to know you the difference, so that pata chal jaye. miRNA is endogenous, siRNA is exogenous, right? And it binds to the 3' UTR. It is imperfect binding, not a perfect binding, right? It does just the translation repression. This is stored in P bodies. This is another one-liner question that can be asked in the exam. Whereas whenever we talk about the silencing RNA, there is a perfect binding and it destroys the mRNA completely. It just does the temporary repression of the translation of that mRNA. That is the function of miRNA. Temporary, T-E-M-P. So miRNA. miRNA does the temporary, right? And is imperfect. So you can remember it by using the M. Imperfect and the translation repression, or temporary repression it does. Okay. Enzymes that are used as the diagnostic tool. So we have to find the best pair. Lipase, acute pancreatitis. Well, this is the choice, very first choice. For the acute pancreatitis, there is a lipase and as well as the amylase, right? Lipase is specific marker. Amylase is not a specific marker because the amylase concentration is also increased in the salivary gland disorders, right? And there is also, since the choice is not here, but for your information, serum trypsin level is the most accurate lab indicator for the pancreatitis. Okay, but routinely available nahi ho raha, but in rare cases it is available, and that is the most accurate method to find the acute pancreatitis. The next choice is ceruloplasmin hepatolenticular degeneration. Well, this could be a choice, but since we have to just pick one, this is also a correct choice. Ceruloplasmin levels are unreliable method actually to check for the hepatolenticular degeneration. What this hepatolenticular degeneration is, it is also known as the Wilson disease, which is a carbon metabolism disorders, and the culprit gene is ATP7B gene. This is another question that might be asked in the upcoming exams in a one-liner. Wilson disease is related to ATP7B disorder. This is the gene, right? Its prevalence is 1 into 30,000. And when we are checking the copper levels, right, because of this metabolism disorders, the age is an important factor. We should check for. The diagnosis is done by the typical like neurological symptoms are there because of the copper deposition in the neurons. Then there is a presence of the Kayser-Fleischer ring in the eye, right? This was asked in the last exam that just happened few months back, okay? And decreased serum ceruloplasmin concentration is another diagnostic method for this. And investigation, when we are checking the severity of the Wilson disease, then penicillamine challenge test is done. Even during the therapy also, this is done. Liver copper is measured, then detection of the gene mutation, and the known ceruloplasmin bound copper is also, but that is unreliable method. So these two choice both are correct. Choice A is much better option than the choice B. Now when we talk about the choice C, that is beta glucocerebrosidase and von Gurkey disease. Well, beta glucocerebrosidase is not the von Gurkey's, but it is related to the Gaucher disease with the GBA gene defect, and because of the defect in the gene, the enzyme glucocerebrosidase is deficient, which is digesting the glucocereboside. Since the enzyme is deficient, there will be an accumulation of glucocereboside in the lysosome. So it is also known as the lysosomal storage disorder, right? And the diagnosis is because of the increased level of the alkaline phosphate. There is an unbalance in the angiotensin converting enzyme. Immunoglobulin levels are checked because of beta glucocerebrosidase, right? And since this the undigested glucocerebrosidase sites are accumulated in the lysosomes, when we look at inside the electron microscope, then these lysosomes look like a crinkled tissue appearance. So crinkled tissue appearance is one of the indicative of this Gaucher disease also. क्वेश्चन किसी तरीके से भी पूछा जा सकता है एग्जाम में. वॉन गरके डिजीज इज अ टाइप 1 ग्लाइकोजन डिसऑर्डर, storage disorders, and it is because of glucose 6 phosphate translocase deficiency. Okay, so this is not the choice. Then the next choice is LDH1 and LDH2 ratio in the myocardial infarction. When MI or myocardial infarction, the diagnostic markers are the troponin and the creatine kinase isoenzymes, and the diagnostic methods are chest radiography, coronary angiography, echocardiogram, PET, right? Which of the following is not a part of SAYS regimen meant for the trachoma, right? What is this trachoma? Trachoma is like caused by chlamydia trachomatis, and it is a world leading cause of the blindness. And when we talk about this safe regimen means S stands for the surgery of trichiasis, A is the antibiotic therapy, F is the facial cleanliness, and E is the environmental changes. So choice D is not a part of the safe regimen meant for the trachoma. Match organism and drug with which it is intrinsically and naturally resistant. Well, the answer to this is Candida krusei. It is more of a microbiome question. So Dr. Nasir will be the best person to give you the more detailed information. Well, this fluconazole targets 14 alpha demethylase, right? In Candida krusei, this develops the resistance against the fluconazole, so it does not work. Whereas the another species, Candida glabrata or another, they are sensitive to the amphotericin B. Micafungin kills Aspergillus also, and voriconazole also is not resistant by the Aspergillus niger, right? So choice A is the correct answer, and for more detail, please talk to your microbiome professor. I just wanted to give you the answer. Sideroblastic anemia is treated by pyridoxine. Why pyridoxine? Well, sideroblastic anemia is like these sideroblasts are the premature and nucleated RBCs, right? And what happens is there is the problem with the iron. There is a problem with the enzyme that is involved in the heme synthesis, or porphyrin ring is not formed. Since porphyrin ring is not formed, so this is the nucleated RBCs, right? So what will happen is this iron laden will deposit around the nucleus, giving rise to sideroblastic anemia, right? And these heme synthesis disorder can be congenital or acquired. In congenital, usually it is involved with the ALA synthase enzyme, which is very important enzyme, and that requires pyridoxine as a cofactor to work. And this ALA synthase deficiency is an X-linked deficiency, right? So it is treated by giving the pyridoxine. And ALA synthase is a decarboxylase. That is another indicative, right? It requires the B6 or the pyridoxine. Please remember that all the decarboxylase, I should say most of the decarboxylase and deaminase enzymes, they require pyridoxine as a cofactor to work. Which drug is very important for the serious pediatric COVID-19 patient? Well, the answer to this is the corticosteroid. Remdesivir is, since the patient's age is not given here, right? So up to if a patient is about 12 years old, then remdesivir can be given, right? It is not prescribed for the children under 12 years of old. Ivermectin is given in the adults and the children also for the treatment of the scabies, but those who are under 15 kg of the weight, ivermectin is not prescribed. That is why the best bet to pick up from here is the corticosteroid, which can be given to the patients of children of all ages. रेमडेसिविर 12 से उम्र के बड़े बच्चों को दिया जाता है. आइवरमेक्टिन 15 kg से कम वेट वालों को नहीं दिया जाता है, right? So remember this for the maybe next upcoming exam. Which of the drug, and coming to the next question, NADPH deficiency can lead to all except? Well, these are the enzymes which requires NADPH, right? So any problems with the NADPH leads to the deficiency, or like these enzymes are not going to function properly. So G6PD, that is related to hexose monophosphate shunt, right? It is also this, instead of NADPH kahin likha hoga G6PD deficiency also, or it question can state as a ribose ka issue hai, right? And that deficiency can lead to all except. Answer will be the same. What NADPH is done is like glutathione plus glutathione. Glutathione plus glutathione, right? In this reduced state can be oxidized to GSS, right? This is GSSH and GSSH. This get by the glutathione oxidase enzyme. While going back, doing the reduction, what we need is, we need NADPH. NADPH is involved here. So if NADPH is deficient, definitely there is impaired glutathione. And glutathione is involved in the RBC protection. It is involved in the RBC protection. Impaired NADPH, impaired glutathione will lead to increased RBC lysis, which will decrease the fatty acid biosynthesis also, because it is involved in the free radicals, right? But during when the RBC lysis is increased, there in the stress RBC lysis is increased. During that stress, lipid peroxidation will increase, right? So this is not the choice, lipid peroxidation, right? Let me say it again. NADPH is involved in for the reductive biosynthesis of like the fatty acids you need for the production against the free radical injuries and for the cholesterol synthesis also. So if there is NADPH deficiency, then you have the impaired glutathione, you have impaired mechanism to protect the RBCs from the free radicals. So RBC lysis will be more. There will be decreased fatty acid biosynthesis, but because of NADPH deficiency, stress level because of the presence of the free radicals are high, that will lead to the increased lipid peroxidation, not the decreased lipid peroxidation. So answer C is the right choice. Which fusion exocytosis complex is affected by tetanospasmin? Well, we have these two toxins, tetanospasmin as well as the botulinum, right? This causes spastic paralysis. This causes flaccid paralysis, right? So both are involved in the docking step, which is related to the neurotransmitter release. Tetanospasmin inhibits the GABA and the glycine, and the excess acetyl coenzyme A is released and the muscle go extreme spasm, and that infects the synaptobrevin. Tetanospasmin affects the synaptobrevin, whereas botulinum affects synataxin and SNAP25. So D is the right choice. Black bag is disposed for. Black bag is disposed for the regular disposal, right? So choice A is the right choice. That is the glove paper. But just for your information, for those who want the details, there are yellow bags also, right? These are used for the infectious waste, including medicine contaminated infectious waste, right? Like the PPE, wipes, IV bags, chemical contaminated waste. Now there are orange bags also. These are also used for the infectious clinical waste. Sometimes you will see the yellow, sometimes you will see the orange. Now the yellow bags with the black stripe, also known as the tiger bags, क्योंकि टाइगर्स के जैसा ब्लैक ब्लैक स्ट्राइप उसके अंदर होता है, दे हैव द ऑफेंसिव वेस्ट लाइक द सैनिटरी nappy waste, right, from the public and the work based female toilets में होता है, right, the wipes and the dressings and the plasters which are non infectious, all those things they go in the yellow bags with the black stripe, majorly the sanitary and the nappy waste, remember this, okay. Black bag is for the general domestic waste that cannot be recycled, ठीक है. If there is an option for the natural clear bags में हम ये सब डालेंगे the recyclable materials, that is the paper, cardboard, paper towels, newspaper, magazines, clean plastics, tins, ये सब डालेंगे which can be recycled. But if there is a choice just of a black bag, you just pick the black bag. That usually black bag is for like that cannot be recycled, and the natural clear bags are for the recyclable material. Okay. Hypersensitivity 1 includes, well, there are 4 kinds of hypersensitivity: type 1, type 2, type 3, and type 4. Right? In the type 1, these are the reactions mediated by the immunoglobulin E antibodies, whereas type 2 are the cytotoxic reactions which are mediated by IgG and IgM antibodies. Type 3 are mediated by immune complexes, and type 4 are the delayed reactions mediated by the cellular response. Hypersensitivity in 1 includes actually all of them, right? Because hypersensitivity 1 is first of all the immediate hypersensitivity. It involves the IgE, right? And it is triggered by re-exposure of a special antigen or an allergen, right? Allergen can be ingested, inhaled, injected, or in the direct contact, right? It results in mast cell degeneration, which releases the histamine and other inflammatory mediators such as histamine, prostaglandin, new leukotrienes also, right? For example of hypersensitivity 1 is the anaphylaxis, allergic rhinoconjunctivitis. Question number 17 is, which is the most accepted method of hemoglobin A1C estimation? When all these methods that are given are used for the hemoglobin A1C estimation. But when we talk about a reference method, then the ion exchange chromatography is the right choice, which should be the choice in the exam, right? And since this in ion exchange chromatography specifically for this case is a cation exchange chromatography, because the glycosylated hemoglobin is positively charged, right? So whenever we have a column, then this positively charged will attach to the walls of the column and everything will elute out. Then the buffer will be added so that it elutes the attached adhered glycated hemoglobin, and then we take out that elute and finally do the analysis for that. So this is the ion exchange chromatography is the reference method. And for the diabetes diagnosis, actually we need the fasting plasma glucose value and 2-hour plasma glucose during 75 gram oral OGTT, right? And the hemoglobin A1C. These are the 3 methods for the diabetic diagnosing. And for this method, right, the recommended guidelines are by NGSP and also by the DCCT, that is Diabetic Control Complication Trial. So based upon DCCT, this is the best choice, or as you can say, the reference method used. Next question is, all of the following act as an inhibitor of cytochrome oxidase except, right? Well, we are talking here about the electron transport chain, right? Electron transport chain, we are dealing with the 5 complexes, right? These are the 5 complexes, complex 1, 2, 3, 4, and 5, right? Complex 2 and 5, sorry, complex 3 and 4, sorry, they are the cytochrome oxidase we are talking about. So we are talking about which is not inhibiting this cytochrome C oxidase. Well, these are the inhibitors. Cyanide, it inhibits the cytochrome C by inhibiting the complex 4, right? And the other are carbon monoxide, also hydrogen sulfide. All these gases, they inhibit the cytochrome oxidase, not the methane, which is the choice D, right? Methane does not act as an inhibitor, but the gases hydrogen sulfide, cyanide, carbon monoxide, they inhibit the cytochrome oxidase complex. Which of among the following is required more in lactating mother as compared to pregnant woman? Well, this is a gynecological question and maybe from nutrition, but vitamin A is the choice, right choice for this question. More details you can get from your notes. In a discharged COVID patient, which of the following advices can you give post-discharge? Right? Discharged COVID patient. Loss of smell has nothing to do. This is not the choice. This is headache, diplopia, facial pain is leading to the bleeding, right? So this is the best bet. Though it is saying that after 7 days that might change depending upon the patient that was admitted was symptomatic and asymptomatic. Remember, the question is based upon the recall, memory, बच्चों को कितना याद था when they come out of the examination hall. So I have tried to make the best question out of it. So for you, let me tell you about like specific things. According to WHO, the criteria for discharging patients from isolation, right, for the symptomatic patients as well as for the asymptomatic cases, those cases over here, right? For the asymptomatic cases, right, 10 days after positive test of SARS-CoV-2 and 10 days after जिसका symptom onset हुआ था. तो this is the criteria कि symptomatic patients कौन से हैं, asymptomatic patient कौन से हैं. Asymptomatic is positive है SARS-CoV-2 का test, but they are not showing the symptoms. So this is how we categorize. If they get the negative test, then they can be discharged. How? If a patient has symptom for 2 days, the patient can be released from the isolation after 10 days. Or you can say 10 plus 3 days from the day of the symptom onset for the symptomatic patient. For a patient with symptoms for the 14 days, the patient can be discharged after the 17 days. This is about the discharge. Now, this is from the government website. What is the discharge policy for the COVID-19? For the mild and the moderate, what is given is there is no RT-PCR test that is required. But for the severe, the patient should be negatively RT-PCR. Then after the 7 to 10 days, RT-PCR test is done again to check if the infection is there or not, right? And for the moderate patient, the things that are monitored is whether they are able to maintain the oxygen saturation for 3 days. There is no oxygen requirement. Okay. So these are the discharge policy for the COVID-19. Next question is, which method is not used for protein precipitation? What is protein precipitation? It is a down regulation process in which by adding a reagent or by changing an environmental condition, the certain kind of a solute that is there in the solvent is made to precipitate or come out of the solution. There are many ways. These are like the solution when these are the solutes, they are occupying the different chairs, right? Like a musical chair game. If some external entity can go and take its chair, it has to come out of the solution. जो existing hai, that is one way of precipitating out. One way is you change the PI. PI is isoelectric point is a point where pH, there is no pH, but that doesn't mean there is no charge on the protein. Charge is there, but positive charge equals negative charge, so there is zero net charge. One thing students make a lot of mistake. The Pi doesn't mean no charge. It means net charge is zero, but there is positive and negative charge. So either by increasing the pH or decreasing the pH, we can elute it out. Example is how we make this cottage cheese, or you can say the paneer, right? What we do is we change the pH by adding the nimbu or the citric acid, vitamin into it. We make it more acidic. That makes the protein to come out. In biotechnologies, where we use the protein precipitation, like the live examples for the human body is when we have to purify the blood samples. Then we use the protein precipitation. Then salts of heavy metals are used, alcohol and acetone, trichloroacetic, except changing pH. This method is not used for protein precipitation. The advantage of alcohol and acetone is when acetone is added, that does not denature the protein that is precipitated out. Otherwise, all other methods, they denature the protein. Next question is, which of the following is true regarding physiological jaundice? Well, most infants, they develop the visible jaundice due to the elevation of unconjugated bilirubin concentration, right, during the first week. And this is known as the physiological jaundice. And it is classified into distinct periods, which we are not discussing in right now. This is because of the low enzyme concentration of glucouranosyl transferase enzyme. Before birth, this enzyme was not present, but as soon as the baby is born, usually sometimes it takes a little bit of time to upregulate this enzyme. This enzyme converts the unconjugated bilirubin, right? And then that is passed from the body via the urine. So in physiological jaundice in the newborn baby, there is an increased indirect bilirubin level and there is a decreased urine bilirubin, right? So this is the choice. Very straightforward question. The increased urine bilirubin is not in the case of the physiological jaundice, but this happens in the obstructive jaundice. Okay. Now there was this question, this type of curve is seen with what? The glucose oxygen dissociation curve, carbon dioxide binding, dinitrophenol binding. Well, for this we should be knowing whether this is a competitive or a normal or a cooperative binding, all kind of thing. Whenever we talk about the allosteric enzyme, that has a cooperative binding and unbinding, like oxygen dissociation curve. Whenever we will talk about oxygen dissociation curve, that will be an sigmoidal shape. And right, this is a switch like transition. So these cannot be choices, because we know that whenever oxygen binds to this tetramer of the hemoglobin, first molecule will, when it will bind to the hemoglobin, then it will assist in the binding of another oxygen molecule to the another polypeptide, and the two together will help the third oxygen to get bind. ऐसे चौथा bind करेगा. So this is a cooperative binding which will give rise to the sigmoidal. Whereas same thing happens with the carbon dioxide binding and unbinding. That is a cooperative. In that case, we will get the sigmoidal curve. So these are not the choice. The dinitrophenol is an inhibitor, is a competitive inhibitor. So whenever we have a competitive inhibitor, or like say non-competitive inhibitor, in case of a competitive inhibitor, we will have a curve something like this. In case of a non-competitive inhibitor, we have a curve something like this. So these both are not the case. So this is a normal enzyme thing that is going on, we are talking about. So the best choice for us is the glucokinase. Now, so for the glucose, now if the enzyme name would have been given like a glucokinase or the hexokinase, again, there can be curve like this or there can be curve like this, depending upon the affinity of the enzyme. Okay, but the curve look like the simple Michaelis-Menten curve. Question number 25 is the deficiency of 5-alpha reductase. Another very important, like high yield topic. I have seen this in previous exams also, right? Is seen in which of the following? Very straightforward. This is related to the main pseudohermaphroditism, right? What this enzyme does is it converts the testosterone into dihydroxytestosterone. And this dihydroxytestosterone is responsible for the male type external genitalia. So what will happen is when the baby is born, because of the deficiency of this enzyme, rather than having the male type, the female type genitalia is there. As soon as the baby becomes around the 12 years of the age, testosterone's level will go up. That will overpower this reductase deficiency and will start producing dihydroxytestosterone, and the female genitalia will start looking like the male genitalia. This is also known as the penis at 12 syndrome. Okay, so that is a male pseudohermaphroditism. Now, the female pseudohermaphroditism is also known as congenital adrenal hyperplasia, also known as adrenogenital syndrome. It is inherited defect in this stress-related hormone cortisol. Okay, and this is because of 21 hydroxylase deficiency. So this will be the female pseudohermaphroditism. When we talk about true hermaphroditism, then that, let me erase this. Right, this is choice C, right, and this was choice B. Choice C is true hermaphroditism, that is related to the germline like S gene mutation, which SRY gene is mutated. It is also known as ovotesticular disorder or intersex condition. Individual is born with both ovarian and the testicular tissues. So choice for this 5-alpha reductase is male pseudohermaphroditism. If the choice given like the question enzyme was 21 hydroxylase, then the answer should have been the female pseudohermaphroditism. And in the case of SRY gene mutation, then that case is the true hermaphroditism, when both the ovarian and the testicular tissues are present in the newborn. Next or last question is HCG is structurally and functionally similar to the luteinizing hormone. HCG is a placental hormone, you know it, and LH luteinizing hormone is secreted by gonadotrophs in anterior pituitary. So it is very straightforward question, right? Thank you and good luck for your upcoming NEET PG exam. Please revise these questions because all the topics that are covered in this video recording are high yield topics, and I have tried to cover every question that is related to these topics. Good luck for exam. Take care.